There we go. Good afternoon, everyone. I'm former State Senator Polly Baca, and I am delighted to welcome everyone that is on this link to a really interesting conversation. We've got three amazing guests. We're missing Rudy Gonzalez, who will join us shortly after his technical difficulties are resolved. But I'm excited that we're going to be talking about health resources that are important for the Latinx community. It's so important that, particularly during this specific time, that we have the knowledge in our community of where we can access medical services or healthcare services. And so this is a group of individuals that can help us find those resources. And now I'd like to ask each one of our panelists to introduce themselves.
Hi, my name is Hilali Avila. I'm a community public health specialist.
Hello, my name is Dr. Ricardo Gonzalez. I am a coordinator for the Ventanilla de Salud program at the Mexican Consulate for Servicios de la Raza.
Hi there, my name is Dr. Lilia Cervantes, and I'm an internal medicine physician at Denver Health. And my parents moved here as immigrants from Mexico, and I grew up in the Val Verde and Westwood neighborhoods.
Thank you all. And I believe that we have a program where each of you is going to address our audience for a few minutes. Would you like to start that process, Dr. Ricardo Gonzalez?
Would you like us to do our introductions in Spanish also?
Yes, please. Yes, let's do that right now.
Yeah.
Hola, bienvenidos. Mi nombre es Odalis Ávila. Soy especialista de salud pública y trabajo en Servicios de la Raza.
Yo soy Ricardo González, soy el coordinador del programa de Ventanilla de Salud del Consulado de México en Denver, también en Servicios de la Raza para servirles.
Buenas tardes, soy doctora Lilia Cervantes y trabajo en el hospital de Denver Health cuidando a la gente que se interna. Mis papás son inmigrantes de México y yo crecí en la parte de Denver que se llama Westwood y Valverde.
Thank you. And perhaps we can, I know that we each have an agenda, and perhaps we can take a look at that and then go ahead and follow that agenda. Let's see, I'm trying to pull that up myself right now. Why don't we go ahead and get started with the...
Yeah, I can go started.
Go ahead.
So first, I'm going to quickly touch base on the importance of getting health insurance. So having health insurance is important for several reasons, but primarily uninsured people receive less medical care and less timely care, and they also tend to have worse health outcomes. With a health insurance plan, you can receive coverage or partial coverage for essential health benefits, such as emergency services, hospitalizations, whether that's surgeries or overnight stays, mental health services, outpatient care, prescription drugs, all of that. Health insurance plans also cover free preventive health services, such as vaccinations, screenings for things like depression and diabetes, different services for women, such as mammograms or cervical cancer screenings. And right now, with COVID-19, if you are covered by a comprehensive health plan, you should be able to access telehealth services at no cost, which include video or phone visits with your physician. You should also be able to refill an additional one-time early refill for any necessary prescriptions. And you should be able to access COVID-19 testing at no cost if there's testing available. There's all sorts of benefits that come with having health insurance because you're then able to treat the primary cause and prevent illness altogether rather than having to treat the illness itself. Right now, Connect for Health Colorado is also having a special enrollment period because of COVID-19. So anyone in Colorado can apply for health insurance right now if they currently don't have health insurance, if you have recently lost your health insurance, or if you know you will be losing your health insurance soon. If you would like to sign up for coverage, you can complete the application online and select the health insurance plan through the Connect for Health website, or our enrollment specialists at Servicios de la Raza are also taking phone appointments, and they can assist you with filling out an application and selecting a health insurance plan over the phone. The current enrollment period does end on April 30th, which is next Thursday, so a week from tomorrow. And once you fill out an application and enroll, your coverage will then begin on May 1st. So if you're interested and you would like more information regarding the open enrollment or finding out what type of health insurance plan you and your family may qualify for, you can call this number. It's 303-953-5940, and you can receive help from one of our enrollment specialists. Now, as far as qualifying for Medicaid, your qualification or being able to qualify for Medicaid will all depend on your family size and the household's monthly income, and that is your gross income, so what you earn before taxes. And in order to receive Medicaid, you must be a U.S. citizen or be a legal permanent resident for more than 5 years. However, if maybe parents that are not citizens or not permanent residents, you can still apply for Medicaid for your kids.
Thank you so much. Would you like to share some of that in Spanish?
Yes, I'll go ahead and go over that. Ahora voy a decir toda esta información otra vez en español. Primero voy a hablar rápidamente sobre la importancia de obtener aseguranza médica. Tener aseguranza médica es importante por varias razones, pero principalmente las personas sin aseguranza médica reciben menos atención y atención menos oportuna, y muchas veces también tienen peores resultados de salud. Cuando uno tiene aseguranza médica, usted puede recibir cobertura o cobertura parcial para beneficios de salud esenciales, tales como servicios de emergencia, cirugías, servicios de laboratorio, servicios de salud mental, embarazos o medicamentos. Y las aseguranzas médicas también cubren servicios de salud preventivos sin costo, como vacunas, exámenes de detección de depresión o diabetes, diferentes servicios para mujeres como mamografías, pruebas de Papá Nicolau y atención prenatal a mujeres embarazadas. En este momento, con el coronavirus, si usted está cubierto por una aseguranza médica integral, usted tiene la oportunidad de acceder a servicios de telesalud sin costo, y esos son visitas de video o por teléfono con su doctor. También tiene la oportunidad de surtir una receta adicional que sea necesaria y acceder a las pruebas de coronavirus sin costo si hay pruebas disponibles. Hay todo tipo de beneficios que vienen con tener aseguranza médica, porque entonces uno es capaz de tratar la causa principal y prevenir la enfermedad en lugar de tener que tratar la enfermedad en sí. Ahorita también Connect for Health Colorado está actualmente teniendo un periodo de inscripción especial por el coronavirus. Entonces, cualquier persona en Colorado puede solicitar una aseguranza médica en este momento si actualmente no tienen aseguranza médica, si ha perdido recientemente su aseguranza médica o si sabe que va a perder su aseguranza médica pronto. Si desea inscribirse, puede completar una solicitud en línea y seleccionar un plan a través del sitio web de Connect for Health, o nuestros especialistas en Servicios de la Raza pues, también están tomando citas telefónicas y pueden ayudarle a llenar una solicitud y seleccionar un plan de aseguranza médica por teléfono. El periodo de inscripción terminará el 30 de abril, que es el próximo jueves, y después de que se inscriba, su plan comenzará el 1 de mayo. Si desea obtener más información sobre el periodo de inscripción o nada más averiguar qué tipo de aseguranza médica usted y su familia pueden calificar, pueden llamar al número de 303-953-5940. Ahora, para calificar para Medicaid, lo que hacen para ver si uno califica para Medicaid, todo depende del tamaño de la familia y de los ingresos mensuales del hogar. Y estos son ingresos en bruto, entonces lo que gana antes de impuestos. Y para poder recibir Medicaid, uno debe ser ciudadano o ser un residente permanente por más de 5 años. Si es que los padres no son ciudadanos o no han sido residentes permanentes por más de 5 años, todavía pueden solicitar Medicaid para sus hijos. Eso no es problema.
Gracias. Thank you so much. And Dr. Gonzalez?
Thank you for the opportunity to be here. And the first thing I would like to say is this: I hope that everybody's staying safe, and I think that the best doctor is the one that you never see. The doctor's far away, that's better. But in case that you need a doctor because you feel, and just talking about COVID-19, in case of you're having the need of finding a provider, well, the first thing I need to tell you is call the provider that you already have. You don't need to try to find a specialist in COVID-19 because we don't have one. So find your provider and they will guide you step by step to what you can do. Now, there's a series of people who do not have a provider, who have never seen a doctor, and then perhaps we'll need to find a different approach. And there's a lot of numbers that I would like to share. I think it's difficult for people to write them down, but if you can just, maybe someone can put them later on, post them someplace, but 303-389-1687 for questions about coronavirus. This is Denver Health. You can get this information from them. If you do not have a doctor and you have a Medicaid, then there's a Health First Colorado, healthfirstcolorado.com, C-O-M. You log into there and it will tell you different regional organizations that have providers according to the place you live in the state. So you can find your providers there. If you are someone who doesn't have access to Medicaid, then we have to go to different clinics, and there's another very interesting place. It's cchn.org. This is Colorado Community Health Network, and they include at least 21 community health centers in the states, and they in the state of Colorado, and they have clinics that are close to where people live. I think that the best option is to call first, see what they're doing, and then they will connect you to their programs that they have right now on telehealth or telephone consultation, and they will tell you if you have to go in person. A lot of places are doing tests now. Hopefully we will have more. Our Department of Public Health is doing tests specifically in certain areas, but certain urgent care facilities are doing tests now, like advanced urgent care, like American Family Urgent Care, and other clinics. So I think that the best way you can do is contact one of those three options that we gave you. Now, I will say this in Spanish. La primera parte que comentábamos en inglés es que el mejor médico es el que está lejos. Si no ve uno al médico porque está sano, es mejor. pero ante estas circunstancias siempre es importante tener un médico. Y la primera opción para que usted atienda su salud es buscar a su médico de cabecera, el que siempre lo ha atendido. Él o ella puede darle información al respecto de lo que hay en su comunidad, en el lugar donde usted vive, con relación al COVID-19. En el caso de que desafortunadamente no tenga usted un médico de cabecera, su médico de cabecera no tenga información para darle, tenemos un número que ya mencionábamos en inglés, el 303-389167. Este es un número que Denver Health ha puesto a la disposición de las personas para hablar, para recibir, para resolver dudas sobre coronavirus. También a través de el programa de Ventanilla de Salud del Consulado de México tenemos una línea que es el 720-589-4187. Esta es una línea en español. Si alguna persona quiere llamar a ese teléfono, está abierto de lunes a viernes de 9 de la mañana a 5 de la tarde, 720-589-4187. Si usted ya tiene algún tipo de seguro médico a través de Medicaid, entonces el siguiente paso es que busquemos Health First Colorado, healthfirstcolorado.com. Ahí encontrará usted, dependiendo de la región donde vive, cuáles son las organizaciones que lo pueden atender. Y si usted desafortunadamente no tiene acceso a Medicaid, o si tiene y quiere usar otro servicio, está el cchn.org, Colorado Community Health Network.org, que tiene una serie de clínicas registradas en todo el estado para poderlo atender, o sea, no nada más personas que vivan aquí. Finalmente, estábamos diciendo que hay diferentes sitios donde pueden atender a obtener una prueba para ver si usted está infectado. Tendremos en el futuro cercano más pruebas y también nos van a decir quiénes son las personas que requieren eso, pero la mejor manera para solicitar es que contacte al proveedor de salud que le quede cerca. Thank you.
Hi, everyone. This is Lily Cervantes again. I want to briefly talk to you all about 3 things: ways to stay healthy, what to do if you get sick, and then when will this all be over. But before we jump into that, I saw 2 questions related to health insurance. One was, how can I apply for insurance if I do not have access to a computer? And so if you know the type of insurance you want to apply for, you can hopefully, find the number online just using your phone and then call them and they will take your information. Can I still apply for insurance during this time if I have a job but I do not have health insurance? Yes. In fact, several health insurance companies have opened for enrollment because of COVID-19. And I was, while Ricardo was speaking, looking on my phone, and I found that one of those is Connect for Health. And so they actually have open enrollment now through April 30th. So you have 8 days with Connect for Health. If you don't have a phone, don't have Wi-Fi or computer, and you just want someone to help you with enrollment for a health insurance, you can also always walk into a hospital. Like Denver Health, for example, has enrollment specialists. And so if you walk in, they can help you enroll for a health insurance. And so I'm going to go ahead and move on to talk about ways to stay healthy, what to do if you get sick, and when and how things will come back to normal. And then once I'm done, just going over this in English, I'll go over it in Spanish too. I think that right now it can be really tough to stay healthy, but there are several things that we can do. One of the most important, I think, ways to stay healthy is to make sure that you exercise every day. And I know that a lot of people have talked about this online, but there truly are several classes that you can sign up for. You can use your phone. You can use a computer and sign up for Zumba, yoga, and lots of other types of exercise. You can also go on walks. You can run. If you have children, one thing we've done, I have 2 small girls. We go outside and we kick the ball, we play volleyball, or we play chase. The second thing I want to mention as a way to stay healthy is for those of you that are feeling anxious or sad, there are lots of ways to cope. I, tend to recommend that people go outside, every few hours just to get some sunlight and move around and take a breath of fresh air. Other people recommend meditation. There's ways to learn to do meditation by using a phone app or, again, an online video. And then connect with family and friends using your phone. A lot of people are FaceTiming. In fact, right now I am FaceTiming more often than I ever have with my family, and I feel really close to them because we're FaceTiming so often. And so that's something you can do. We also do lots of arts and crafts with our kids because it helps them sort of take their minds off things. And I would say if it gets to the point where you feel like hurting yourself or hurting someone else, or if you just feel like the anxiety and the depression is too much, call 911 so that a healthcare provider can see you and take care of you. The last thing I wanted to mention about sort of having emotional distress is that for children, and I've noticed this in my own children, having the news on all the time or reading or discussing COVID-19 can be a lot for them to take. And so sometimes it's important to let them take breaks from hearing about COVID-19 or just all completely avoiding hearing about this. And then the third thing I wanted to mention is a third way to stay healthy is how do we avoid exposing ourselves to coronavirus? I think it can be really difficult because we all require, resources like food and things like that. And some of us have to take public transportation or we still have to go into work. And so some things that we can do to take care of ourselves include washing your hands. And I know that everyone talks about washing your hands, but I can't stress how important this truly is. And it's not just a simple, quickly wash your hands with soap and water. It's making sure that you get your fingertips between your fingers on the backs of your palms and just washing your hands very rigorously for at least 2 minutes. I tell my girls to sing one of their favorite songs while they're washing their hands just to make them wash their hands long enough. If you don't have access to water and soap, for example, if you're on public transportation or going to work, one thing you can do is carry hand sanitizer in a small bottle and use that when you're commuting. Wearing a mask is really important. And why is it so important? I think one is, if you're sick, it sort of keeps all those fomites inside so that you're not exposing other people. But the other thing, and the reason I think it's really important for me, I'm not sick, but it sort of is a reminder to not touch my face. Because when I have the mask on, I'm not, scratching my eyebrows or, touching my mouth or anything. So it's a reminder to not touch my face. If you are exposed to lots of people with COVID-19, something else you can do is when you get home from work or get home from the grocery store is take a shower, throw all your clothes into a plastic bag, and then wash it. The third thing we do is if we end up buying restaurant food, or actually even when we buy groceries or any product, we sanitize it. For example, if we buy food from a restaurant, we'll move all that food into our own silverware or plasticware and throw away all the containers from the restaurant just to make sure that we get rid of the virus, and then we reheat everything. This is a virus that is easy to kill. And so, if you're getting restaurant food, just make sure that you reheat it. When we buy food from the grocery store, we throw away all the boxes, the cans, the bags, and then sometimes we'll even get a towel and have some bleach on it and clean off all the containers and then wash all the fruits and vegetables in soap and water. What to do if you get sick? If you get sick from something other than coronavirus and you would normally go to the hospital, I think it's important to keep in mind that you still should go to the hospital. I had a friend of mine reach out to me last week that had chest pain, and they wondered if it would be too dangerous for them to go to the hospital and expose themselves with COVID-19. And I recommended that they go to the hospital because at the end of the day, chest pain can still be a heart attack and you still need to see a doctor. Same thing if you get fractured or have any other medical problems. So you really have to sort of weigh the risks and benefits. if you get sick and you're having symptoms that you think could be from COVID-19, those symptoms could be a fever, cough, a sore throat. And in the US, a lot of patients are actually having diarrhea from COVID-19. So, you know, if you're having any of these symptoms, what you can do is self-quarantine yourself at home. The best place to self-quarantine is in a bedroom that has a bathroom, okay? So that you're not leaving your room to use the bathroom, and because it's possible to expose other people through feces or fecal matter. And so if you can self-quarantine yourself in a bedroom that has a bathroom, that would be ideal. And then, you know, just let your family bring your meals and leave them at the door for you. If you can't self-quarantine in a bedroom, then what you can do is at least sort of keep your hands clean, as I mentioned, have your family wear masks, you can wear a mask, and then sanitize all the high-touch surfaces like faucets, doorknobs, and things like that, using bleach often to sort of sanitize everything inside your house. The people that we typically hospitalize are people that are very sick. So these are people that maybe can't keep anything down. They're vomiting and they can't keep anything down, or they're short of breath, or they need oxygen. And so something I would do if I was sick with COVID-19 is get a pulse oximeter. I don't know if you guys are familiar with those, but those are little machines that you can put on your finger, and it tells you what your oxygen level is. Typically below 90% is low enough to need to get medical care. And so, you know, most people are able to sort of get through a viral infection at home and be okay. But if you think you need care, definitely always go to the hospital. Right now, our hospital is testing patients that are being admitted to the hospital. So not everyone that comes to the hospital will get tested unless you're being admitted to the hospital. When and how things will get back to normal, we don't know when things will get back to normal. Honestly, we'll probably be physically distancing ourselves from others and wearing masks for many, many months. We'll need to get sort of to a population level immunity, which means that 60 to 80% of people will need to be resistant to the virus, either because they had it or because a vaccine is made available. And so I would recommend to just, you know, stay on top of the news, the recommendations from the federal government, from the Centers for Disease Control, and follow the guidance and the mandates that are laid out by the city and state officials. And remember that no matter what, for the time being, staying safe right now means staying at home. And now I'm gonna go over that in Spanish. I'm gonna really quick see if there are any more questions. I don't see any other questions. First, I'll go over the insurance piece that I went over in English. Buenas tardes, es la doctora Cervantes otra vez. Quería decirles que por lo pronto han vuelto a abrir la oportunidad de poder aplicar para aseguranza médica. Normalmente uno no puede aplicar para aseguranza médica durante este tiempo, pero por el COVID-19 están permitiendo que la gente aplique para aseguranza médica. Si usted no tiene computadora, no tiene manera de aplicar para aseguranza, hay maneras de poder aplicar para aseguranza si puede obtener el número para la aseguranza, puede llamar por teléfono. También la mayoría de los hospitales tienen personas que pueden ayudar a la gente a aplicar para aseguranza. Entonces, por ejemplo, en Denver Health, si uno va al Denver Health, uno puede aplicar para aseguranza. También lo que quería decirles es que si usted o su familiar no tiene documentos y también no tiene aseguranza, puede siempre recibir tratamiento al ir al hospital. Tienen que darle tratamiento de emergencias. Y la semana que entra, el grupo de Medicaid van a dar noticias sobre ¿cómo se dice?, cubrimiento médico adicional que se va a ofrecer a la gente sin aseguranza que tenga o no tenga documentos. Entonces, por favor, pongan mucha atención la semana que viene a esas noticias. Ahora, la información que les iba a dar era sobre maneras de mantenerse saludable, también qué hacer si uno se enferma y por último, ¿cuándo volverá todo a la normalidad? Ahora, para mantenerse uno saludable, hay varias cosas que uno puede hacer. Lo más importante es hacer ejercicio todos los días. Yo sé que dicen, esa es una doctora loca que quiere que hagamos ejercicios todos los días, pero es muy, muy importante. No quedarse sedentario, sentado todo el día. Uno puede salir a caminar, puede andar en bicicleta, correr, siempre y cuando mantenga su distancia social. Si tiene usted hijos, pueden salir a jugar con la pelota al parque. Ahora, si uno se siente triste o ansioso, tienen que encontrar maneras de sentirse mejor. Yo recomiendo otra vez que la gente salga afuera, que le pegue el sol y que camine. Eso siempre ayuda al estado emocional. También es importante conectarse con las familias o los amigos por medio de internet o por FaceTime. También si usted siente que la tristeza o la ansiedad es demasiado, es importante recibir atención médica y llamar al 911 para que lo vea un médico. Ahora, si usted tiene niños, lo que les dije en inglés es que mis niñas, yo tengo 2 niñas, están cansadas de las noticias del COVID-19, entonces hemos tomado tiempo sin hablar de eso para no causarles tanta angustia. Y también salimos afuera y hacemos arte. Ahora, maneras de evitarse exponerse al virus coronavirus. Yo entiendo que muchos de nosotros tenemos que tomar transporte público. Tenemos que ir a lugares donde hay mucha gente, como supermercados, el trabajo. Entonces, lo más importante es lavarse las manos muy bien. Y no es tanto el número de veces que se lava las manos, sino la manera de que se lava las manos, que se lave las manos tan siquiera 1 o 2 minutos, lavándose bien los dedos, las uñas, atrás de las manos. Ahora, es también muy importante usar mascarilla, tapabocas en la cara, porque eso nos recuerda de no tocarnos los ojos, ni la nariz, ni la boca. Entonces, si por cualquier manera tenemos coronavirus en las manos y no nos tocamos la cara, no nos exponemos a la virus. Ahora, cuando usted está expuesto a mucha gente con la COVID, por ejemplo, si usted trabaja en un hospital o trabaja con gente que tiene COVID-19, puede, a pesar de usar mascarilla y lavarse las manos, en cuanto llegue a casa, cambiarse la ropa, bañarse y echar la ropa en una bolsa, ¿ok? Ahora, si tiene que comprar alimentos de un restaurante o mercado, también es muy importante lavar todo y mantenerlo todo limpio. La comida, si la compra en restaurante, vuelva a calentarla para matar la virus. Y si trae comida del supermercado, limpie todo con una toalla que tenga, ¿cómo se dice?, cloro. Ahora, ¿qué hacer si uno se enferma? Si se enferma por alguna razón que no sea coronavirus, por ejemplo, si uno llega a tener dolor en el pecho o está sangrando o dolor en el estómago, es importante todavía ir al médico, porque puede que usted, si tiene dolor en el pecho, puede tener un infarto. Entonces, entiendo que es importante evitar lugares como hospitales, pero más importante evitar algo grave, ¿verdad? Algo grave personal, como un infarto u otra cosa. Ahora, si usted tiene síntomas de gripe o resfriado o tiene diarrea, diarrea es otro síntoma que hemos visto con el COVID-19, hay cosas que uno puede hacer en casa para prevenir que se enferme otras personas en la casa, ¿verdad? en la casa uno puede mantenerse en cuarentena. Si tiene un cuarto con un baño, eso es lo mejor, porque han dicho que quizás la coronavirus también se puede pasar por medio de, ¿cómo se dice? Ricardo, ayúdame, ¿cómo se dice stool? El excremento. Entonces, por eso es bueno tener un cuarto en cuarentena donde hay un baño. Si no se puede, está bien, pero tiene que entonces tener mucho cuidado de limpiar todo en casa. Por ejemplo, las manillas de la puerta, las manillas para sacar agua, todas las cosas que se usan mucho en casa, siempre mantenerlas limpias y pedirle a la familia que está en la misma casa que también use máscara y que se lave las manos con mucha frecuencia. En el hospital de Denver Health ahorita estamos, solo usamos la prueba de coronavirus en la gente que se va a internar. Muchas personas preguntan, ¿cómo sé si necesito ir al hospital? Entonces, la gente que se interna es gente que está, pues, grave, que necesita oxígeno o que quizás está vomitando tanto o tiene tanta diarrea que le falta líquido. Lo que acabo de explicar en inglés es que hay un medidor de oxígeno chiquito que se puede comprar en Walgreens. Uno mete el dedo y te dice más o menos cómo está el nivel. Normal es arriba de 90, abnormal o lo que no es normal es bajo de 90. Pero siempre si usted tiene preguntas o preocupaciones de su enfermedad, acuérdense que la puerta siempre está abierta y puede ir a ver al médico. Ahora, ¿cuándo volverá todo a la normalidad? No se sabe cuándo volverá todo a la normalidad. Probablemente continuaremos manteniendo la distancia entre nosotros y llevaremos cubrebocas por muchos meses. Tenemos que conseguir un nivel de inmunidad en la población de más o menos 60-80%. La gente tendrá que ser resistente a la virus por haberlo tenido o por una vacuna. Entonces, siempre escuche y ponga atención a las recomendaciones del gobierno federal y del CDC, las guías y mandatos hechos por los funcionarios. Entonces, por lo pronto, la mejor manera de mantenerse saludable es de quedarse en casa. Muchas gracias.
Thank you. Our technical difficulties have been resolved, and it looks like we now have our co-host with us, Mr. Rudy Gonzalez from Servicios de la Raza. And Rudy, would you like to take it from here?
Oh, thank you, Polly. Yes, thank you, Polly, and thank you, Dr. Cervantes, Dr. Gonzalez, Sodales. I lost power here in the complex that I live in, and it all went down and came crashing down. So, but I want to take this time to see if we have any questions. If you have any questions, please put them on the comment section in Facebook or on the chat. If you're on the Zoom, you can ask the questions on chat. So we'll give a couple minutes to see if anybody have any questions. And if not, then we'll talk about, where we go from here.
We did get one question. It says, what can undocumented patients who do not qualify for Medicaid or C4HC do during this time?
Dr. Gonzalez, Dr. Cervantes.
So for now, I know that HCPF is working hard this week on making some changes. And I know that next week, they are going to announce the specifics on the COVID-19 expansion of emergency Medicaid for uninsured, which includes undocumented. One thing that I don't know,
Wow, awesome. Yes.
One thing that I don't know if people are aware of is that if you're uninsured or undocumented it's important to know that if you go to a hospital to receive an emergency medical service, that is always covered by emergency Medicaid, okay? And it is not included in the public charge. That is extremely important, okay? It is not included in the public charge to receive emergency medical service, and it is covered by emergency Medicaid. So if you're undocumented or uninsured and you're hospitalized for COVID-19, your care should be covered by emergency Medicaid.
Also, there's Governor Polis has formed a COVID-19 Health Equity Response Committee. That first meeting is Friday, and we'll meet weekly. It's a fast and furious project that's a committee that's coming together to look at and recommend policy legislation or policy that can change quickly, rules and regs that can be changed quickly, or put some really, especially around, for me, it's the undocumented community, around the three issues: testing, contact tracing, and access to healthcare.
I just want to add that there's several clinics that we work with, not hospitals, not emergencies, but they can also see undocumented people. For more information, the number that they can call is 720-589-4187, and we will connect them with one of these.
Can you say that again, Doctor?
720-589-4187.
Thank you. Any other questions? Well, if not, I'd like, oh, well, maybe we do. There's somebody in the chat. Oh, great. Somebody just put the number down on the chat line. Very good. Thank you, Vanessa. And Cecilia Sardina is giving you accolades, Dr. Cervantes. She took one of your classes, I suppose. Says you're awesome, but we all know that. And I just want to thank all of our guests today, all of our learned guests, Odales Avila, Dr. Ricardo Gonzalez, Dr. Lily Cervantes, and the inestimable Polly Baca for joining today. My name is Rudy Gonzalez. I'm the Executive Director of Servicios de la Raza. I was supposed to welcome everybody, introduce Odales, and tell you how important it is to not only look for resources, but for us to be people that have those, that know about the resources, to share them with our communities and keep sharing them day in, day out, especially during this pandemic and this crisis. We're going to be hosting another resource fair. This one is going to be centered on food security and economic justice. Which, you know, as a social determinant, both of these are social determinants of health, as is housing, as is, you know, the criminal justice system, incarceration. They're all social determinants of our health in this climate change, pollution, all of that. They're all social determinants. And so we're going to be hitting on some of these important topics as they relate to our communities, as they relate to the Latino indigenous communities in this city, in the state, and the fact that, you know, we are disproportionately affected by this pandemic, by this crisis.
Mm-hmm.
We are, because we are the service workers, we are the ones that are showing up to work day in, day out, and we are exponentially exposed to this lethal virus as a result, and we should be getting more attention as a result, not less. And so that's our fight, that's our struggle, and thank you all for sharing all that incredible information and resources. Vanessa, do you have anything to say? Polly? You're still on mute.
There we go.
Oh.
I just wanted to thank you, Rudy, and all of the participants because for this very informative town hall, and I sure hope everybody joins in next week to watch the next town hall that you just talked about, and they'll learn a lot. The Latinx community will learn a lot more then about our economic security and food security.
Yes, I'd like to echo that, Polly, and thank Rocky Mountain Health, Rocky Mountain Values with Hillary Steiner and Vanessa Harmush.
Yes.
Did I get it right? Oh, very good. Oh, on the first try. All right, and thank you all so much for leading, Polly, Vanessa, Hillary, for leading this effort and bringing us on board to help with it, and bringing the incredible Dr. Lily Cervantes. So amazed that we got a little bit of her time today and her genius. So thank you all again. And Rocky Mountain Health, Rocky Mountain Values. I'm sorry,
Yes.
but I'll get it. It'll sink in. It's I've been a little punchy with. We've been stay at home since March 15th. So every day is Groundhog Day. I've missed some meetings that were supposed to happen a day later that I was apologizing for a day earlier that I missed. And, these are meetings with electeds and officials and on committees around this crisis. And, oh no, Rudy, our meeting's tomorrow. So yeah, I'm a little loopy and a little punchy, but I think I agree with Dr. Lily Cervantes. Get out there and get a little walk and take a bike ride and or just breathe some fresh air. It's beautiful. Especially
Hey everyone.
No pollution.
I just wanted to add really quick, we recorded this town hall, so if you need a recording of it, feel free to ask either Rudy or myself from Rocky Mountain Values. We'll also be posting a link on our social media so you can access these resources later on.
Okay, so we're signing off. We'll see you next Wednesday at 3:30, or no, 4 o'clock, around food security and economic justice.
Sounds good.
Take care, everybody. Thank you.
Bye-bye.
That's Hillary. Thank you, Doctor. Doctor, I'll be sending you an email.
Okay, thank you.
And Miss Avila.